Alright, in this video we will be looking at a condition called knee valgus, or also known as knock knees, which is where your knees cave in due to certain underactive and overactive muscles. In the picture on the screen, you will see the left being normal and the right side being the knock knees. The characteristic of knee valgus include many underactive muscles such as the medial hamstrings, medial gastrocnemius, gluteus medius and maximus, vastus medialis, and anterior tibialis. Some of the more overactive muscles may include the piriformis, biceps femoris, and the tensor fasciae lata. The next section is the patient analysis, where I chose to do the overhead squat. It can be seen here when performing the overhead squat assessment that both knees cave in as she squats from both the anterior and posterior view. The first stage of the corrective exercise continuum is the inhibit phase. Inhibitory techniques are used to release tension or decrease activity of overactive neuromyofascial tissues in the body. This can be accomplished through the use of self-myofascial release techniques, also known as the foam roller. The first exercise is foam rolling the biceps femoris and should be done for 30 to 60 seconds on both legs. The next exercise is self-myofascial release of the TFL or IT band. This will be the same as you foam roll it for 30 to 60 seconds. The next phase in the exercise continuum is the lengthening phase. Lengthening techniques are used to increase the extensibility, length, and range of motion of neuromyofascial tissues in the body. This can be accomplished through the use of static stretching and neuromuscular stretching. The first stretch shown here is the TFL stretch, and it should be held for 30 seconds or until tension is released. The second stretch is a lateral gastroc stretch, and it should also be held for 30 seconds or until tension is released. The third phase of the exercise continuum is the activate phase. Activation techniques are used to increase activation of underactive tissues. This can be accomplished through the use of isolated strengthening exercises and positional isometric techniques. The two exercises I chose for the activation phase are the gluteus maximus and gluteus medius cable exercises. The last phase of the exercise continuum is the integrate phase. Integration is used to retrain the collective synergist function of all muscles through functionally progressive movements through the use of integrated dynamic movements. For the integration phase, I chose 4 different exercises. The first 2 being the easier and the last 2 being a little more advanced. The first one being the wall jumps, second being single leg squat, and the more advanced ones, the single leg hops, and then the hardest tuck jumps.